CNP Featured Research. This is your Diet Mental Health Break for April 2026, brought to you by the Center for Nutritional Psychology. 2 minutes to learn and be good to yourself. Consuming lots of flavonoid-rich foods and beverages is associated with a slightly higher likelihood of being happy and optimistic. Psychological well-being is an overarching concept in psychological research that encompasses feelings of happiness, life satisfaction, a sense of purpose, and optimism. People experiencing sustained psychological well-being tend to be happy, optimistic, satisfied with their lives, and tend to see their lives as meaningful. High psychological well-being is associated with numerous health benefits, including lower risks of chronic disease and mortality. This association seems to go in both directions. Better psychological well-being contributes to health, and healthier behaviors contribute to greater well-being. One category of health-related behaviors scientists often explore in relation to psychological well-being is dietary intake. In a study conducted by Dr. Alicia S. Thompson from Queen's University Belfast in Ireland and her colleagues, results showed that people who eat 3 or more servings of flavonoid-rich foods per day tend to have somewhat better sustained psychological well-being. Over a period of up to 18 years, sustained higher flavonoid intake was associated with greater psychological well-being. Flavonoids are a group of naturally occurring plant compounds, polyphenols, known for their antioxidant and anti-inflammatory properties. Flavonoid-rich foods include fruits such as berries, apples, and citrus, as well as vegetables like onions and leafy greens. The analyses presented by these authors are based on data from the Nurses' Health Study, a longitudinal study that began in 1976 and that involves tens of thousands of registered U.S. nurses. In the study, higher flavonoid intake scores were associated with a 3 to 6% higher likelihood of sustained happiness and optimism. Eating specific flavonoid-rich foods, strawberries, apples, oranges, grapefruit, and blueberries, was associated with a 3 to 16% greater likelihood of sustained psychological well-being. Unfortunately, while the results clearly confirmed associations between dietary flavonoid intake and psychological well-being, the observed associations were very weak, limiting their practical value. Our thanks to Alicia S. Thompson and her colleagues for conducting this informative analysis. This Nutrition Mental Health Break is brought to you by the Center for Nutritional Psychology.